Your body has been quietly adjusting something in your feet and legs for a long time. Not loudly, not suddenly, more like a whisper traveling through the ankles, the arches, the calves, trying to keep movement smooth, balance steady, and sensation clear, even when the signals feel faint, fuzzy, tingling, or strangely distant. And here's the part most people never hear. Sometimes the answer is not one aggressive workout, not a complicated routine, and not forcing your body to push through. Sometimes relief begins when you give your nerves, muscles, blood vessels, and joints 6 very specific reminders. Gentle reminders of how to work together again. Stay with me, because beneath those strange feelings in the feet and legs, there may be a silent process unfolding right now. Circulation slowing a little. Muscles contributing less than they used to, joints moving less fully, and nerves receiving a blurrier environment than they prefer. Not because your body is failing you, because your body is trying to protect you, adapt, and keep going with the tools it has. Quietly inside your body, your feet are doing an astonishing amount of work. Each foot contains 26 bones, 33 joints, and more than 100 muscles, tendons, and ligaments, all trying to coordinate with nerves and circulation every time you stand, shift, or take a step. Arthritis foundation. That is why these exercises matter, not because they fix everything overnight, but because they support the hidden systems that keep your feet feeling alive. Think of your lower legs like an irrigation system in a garden. Blood has to keep moving, tissues have to stay nourished, waste has to be carried away. Nerves need a calm, well-supplied environment to send cleaner signals. And when the ankles get stiff, the calves get lazy, and the small foot muscles go quiet, the whole landscape can feel drier, slower, and less responsive. What most people overlook is that the body often responds beautifully to repeated, gentle motion. Even regular walking, done consistently, has been shown to help lower neuropathy pain, improve muscle strength, and support blood sugar control. Which matters, because nerves depend heavily on a stable internal environment. Mayo Clinic. If this makes you see your body differently, tap like. Now let's begin with the first 2 exercises, because they set the foundation for almost everything else. Exercise number 1 is the ankle pump. This one looks almost too simple to matter, and that is exactly why people underestimate it. Sit comfortably in a chair, place both feet flat on the floor, then slowly lift your toes toward your shins and gently point them away. Pull back, point away, pull back, point away. Smoothly, no snapping, no strain. About 15 to 20 repetitions. Then add ankle circles if they feel good. Slow circles one way, then the other. At first, this movement wakes up something many people do not realize has been dozing off: the calf pump. Your calf muscles are sometimes called a kind of second heart for the lower leg because every squeeze helps move blood back upward. And when the ankle bends well, that pump works better. Within minutes, the feet may start to feel a little warmer, a little more present, almost as if the area is being gently reintroduced to itself. Why does this help? Because nerves do not live in isolation. They live inside tissue that depends on oxygen, fluid movement, and mechanical motion. An ankle that hardly moves is like a door hinge that never opens fully. The room behind it does not get much fresh air. So this first exercise is your signal to the body. We are moving fluid again, we are reducing stiffness again, we are creating a friendlier space for sensation again. If your feet are very sensitive, start small. Even tiny ankle motions count. The body pays attention to consistency more than intensity. Exercise number 2 is toe spread and toe curl. Still seated, place your feet on the ground and simply try to spread your toes apart. Even if they barely move, that effort matters. Then gently curl them downward as if you're picking up a soft towel. Open them, curl them, open them. Curl them. 10 to 15 slow repetitions. If spreading the toes feels difficult, you are not doing it wrong. Many people discover that the feet have become quiet in places they never noticed. The small muscles in the feet can become underused when footwear is stiff, walking is reduced, or balance feels uncertain. Soon after you begin this exercise, the bottom of the foot starts receiving more meaningful input. The brain gets more information from the ground. The arch gets support from its own tiny helpers. The toes begin acting less like passengers and more like active guides. And this matters more than it seems, because the toes are part of how your body measures the floor. They help with microbalance. They help with push-off. They help you sense where you are in space. A randomized trial in people with diabetic peripheral neuropathy found that a 12-week foot and ankle exercise program improved fast walking speed. ankle motion, vibration perception, and later quality of life. In other words, small movements in the feet were not trivial. They changed function PMC. Under the surface, your body is always asking one question. Can I trust this foot? When the answer becomes more yes, even slightly, walking becomes less guarded. Here's a friendly way to picture it. Imagine a kitchen at dinner time. The blood vessels are the delivery route. The nerves are the text messages. The muscles are the cooks. The joints are the doors swinging open and closed. If the cooks stop moving, the doors stiffen up and deliveries slow down, the whole kitchen gets clumsy. Not ruined, just less coordinated. These first two exercises are like turning the lights back on in the kitchen. Nothing dramatic, just enough for the team to start working together again. And that leads us to the next stage, because once circulation and small foot awareness begin to return, your body is ready for more support from the muscles above the foot. Behind the scenes, the next goal is not just sensation, it is support. Because when the feet feel uncertain, the body often becomes cautious in a very intelligent way. Steps get shorter, ankles move less, knees stiffen, hips stop trusting the ground below them. You may think the discomfort is only in the feet, but the whole lower body orchestra often starts playing more quietly to protect you. That protective pattern makes sense. But over time, protection can become overprotection, and that is where exercises 3 and 4 come in. Exercise number 3 is the heel raise and toe raise pair. Stand behind a chair or at a kitchen counter so your hands can rest lightly for support. Slowly rise onto the balls of your feet. Pause for a breath. Lower down. Then lift your toes while keeping your heels on the floor. So, rocking back gently onto your heels if that feels safe. Lower again. Rise up, lower, toes up, lower. About 8 to 12 repetitions of each. This pair is simple, but powerful. The heel raise trains the calves, which help drive blood upward and help the body push off during walking. The toe raise wakes up the muscles on the front of the shin, which are important for lifting the foot clearly when you walk. That matters, because one quiet reason people start shuffling is not laziness. It is reduced confidence and reduced lift. As days pass, this exercise teaches the lower leg to share the workload again. The calf says, I can help propel you. The shin says, I can help clear the floor. The ankle says, I can bend and respond. And the brain receives a calmer message. This step may be safer than I thought. That change can feel subtle. But subtle is how biology often works best. Researchers reviewing exercise in adults with peripheral neuropathy found that strength and balance training was safe and effective and was linked with fewer falls along with better lower body strength and balance. That is a major shift from the old fear that people with neuropathy should avoid this kind of movement, PMC, National Institutes of Health. That old belief is worth pausing on for a moment. For years, many people were told, directly or indirectly, to be careful in a way that led them to move less. The intention was protective. But newer evidence suggests that well-chosen movement is often part of the protection. Not reckless movement, not painful movement, but guided, gentle, progressive motion. This is where things get interesting, because the body does not simply respond to exercise by getting stronger. It also becomes more informative. The signals between foot, ankle, leg, and brain can become less foggy through repetition. The body learns through sensation. Exercise number 4 is the seated nerve glide. Now, this is not a stretch you force. This is a glide. Sit tall near the front edge of a chair. Straighten one knee slowly as you lift your toes gently toward your shin. At the same time, keep the movement easy through the neck and back. Then lower the foot and bend the knee again. Straighten and pull back gently. Then release. Switch sides after 8 to 10 repetitions. Some people like to think of this as flossing the nerve, but the important word is gentle. You are not yanking on anything. You are simply encouraging the tissues around the nerve pathway to move more freely. Gradually, this can help when the legs feel tight, zingy, pulling, or oddly tense in a way that is not just muscle. Why might this matter? Because nerves travel through moving parts. They pass behind joints, between muscles, through soft tissue pathways. When everything around them becomes less mobile, the nerve's environment can feel less comfortable too. A glide is like giving that pathway a smoother track. Let me give you a playful picture. Imagine a mail delivery system. The nerve is the mail route. The message is the letter. The muscles and joints are the streets and doorways. If the streets are stiff and the doorways barely open, delivery gets awkward. The letters may still arrive, but not as smoothly. A nerve glide is not forcing the mail truck to speed. It is simply clearing the route. That is why many people notice not only more mobility, but also a strange sense of ease after this movement. Less tugging, less guardedness, a little more confidence when standing up after sitting. Eventually, these middle phase exercises do something deeply reassuring. They show the body that motion is still available. Not perfect motion. Not endless motion, but enough. Enough to help the legs stop bracing so much. Enough to invite circulation, control, and cleaner feedback. And while we are here, let's add an important calm note. If you have open sores on the feet, severe swelling, sudden new weakness, major dizziness, recent falls, or symptoms that are rapidly spreading, this is the moment to involve your doctor or physical therapist before starting a routine. If you have diabetes, daily foot checks matter because reduced sensation can hide small injuries that deserve attention. Mayo Clinic. Listening to your body is not weakness. It is skill. The right sensation during these exercises is mild effort, mild stretch, mild awakening. Not sharp pain, not forcing numb areas, not turning a helpful practice into a battle. Because your body responds best when it feels safe. And now we come to the final two exercises, which tie everything together. Flexibility that gives the nerves and vessels more room, and walking that teaches the whole system to cooperate in real life. What's actually happening is that your body is always trying to create efficiency. If a calf is tight, it will shorten the stride to protect you. If the hamstring resists, it may change how the pelvis and lower back move. If balance feels uncertain, the body may grip the floor, hold the breath a little, and walk as if the ground might surprise you. None of this means your body is against you. It means your body is alert. And the final two exercises help turn that alertness into confidence. Exercise number 5 is the calf and hamstring stretch. Sit near the front edge of a chair. Extend one leg with the heel on the floor and the toes pointing up. Keep the other foot planted. Lengthen your spine gently and hinge forward just enough to feel a stretch behind the calf or the back of the thigh. Hold for 15 to 30 seconds. Breathe. Then switch sides. You can also do a standing calf stretch at a wall if that feels better. One foot back, heel down, body leaning forward softly. Over time, this stretch gives something precious back to the lower leg. Space. Space for the ankle to bend. Space for the calf pump to work. Space for walking to feel less tight and less guarded. And here's the hidden beauty of stretching done calmly. It does not just lengthen tissue, it often changes the conversation between the body and the brain. A tight area that felt threatening can start to feel understandable. The body becomes less defensive. That can matter a lot in neuropathy because when sensation is confusing, the nervous system loves predictability. Slow stretching creates predictable input. Exercise number 6 is walking, or if needed, marching in place. Yes, walking. Or not as punishment, not as cardio pressure, as medicine in motion. If walking feels manageable, start with 5 to 10 minutes at a comfortable pace. If balance is uncertain, use a hallway, a treadmill with supervision, a cane if prescribed, or simply march in place while holding a counter. You can even break it into 1-minute rounds. Walk softly. Let the heel land. Let the foot roll. Let the arms move if they want to. This is where all the earlier exercises come together. The ankle pump prepared circulation. The toes woke up the foot. The heel raise and toe raise strengthened support. The nerve glide improved the pathway. The stretch created room. And walking tells the whole system, now let's use this in real life. Most people think walking only helps because it burns calories or gets the blood moving. But it does more than that. It gives the brain a repeating pattern of information. Pressure, shift, lift, swing, land. Pressure, shift, lift, swing, land. That repetition is deeply organizing. It is like tuning an instrument through use. And this is one reason walking, done regularly, can help reduce neuropathy pain and improve strength. It does not just work on muscles. It works on timing, circulation, blood sugar handling, balance, and confidence all at once. Mayo Clinic. Let's put the timeline together clearly. At first, you may simply notice warmth, mild tingling changes, or an odd awareness of muscles you forgot were there. Within days, the feet may feel a little less stiff in the morning, the ankles a little easier, the legs a little less heavy. Soon after, your steps may begin to sound different. Smoother, less slappy, less cautious. As weeks pass, what often improves is not only sensation, but trust. Trust in standing, trust in stepping, trust in the idea that movement can help instead of hurt. Eventually, the biggest relief is sometimes not dramatic symptom erasure. It is freedom. Freedom to stand longer. Freedom to walk with less fear. Freedom to feel that your body is not betraying you, but responding to what you practice. And that is the deeper message of these 6 exercises. They do not ask your body to be someone else. They ask your body to remember. Remember circulation. Remember control. Remember rhythm. Remember how the foot, ankle, calf, and brain cooperate when given patient repetition. So if you want the full 6 in one calm sequence, here they are again. Ankle pumps and circles. Toe spread and toe curl. Heel raises and toe raises. Seated nerve glides. Calf and hamstring stretches. And walking or marching in place if that is your starting point. Do them gently. Do them regularly. Do them in a way your body can trust. This is biology, not magic. Consistency is what teaches the system. And if one movement clearly makes symptoms worse, if you feel unstable, or if your neuropathy has a specific cause that needs supervision, bring these exercises to your doctor or physical therapist and let them tailor the routine to you. Support is part of healing too. The old story says that strange sensations in the feet mean the body is simply fading. But that is not the whole story. The newer, calmer story is this. Your body is adaptive. Your nerves respond to environment. Your muscles respond to use. Your circulation responds to motion. Your balance responds to practice. And even now, your body may be waiting for the right kind of input. Subscribe for calm science most videos never explain. What would happen if you stayed consistent? Tell me in the comments which of these 6 exercises you want to try first.